Dr. Crayle, lately, the last year or so, there was a lot of news out there about people poisoning themselves with denture cream. Adhesives and, Fixodent, I guess, is one of the main one, but other ones also. Basically, as one has denture, and if the denture is wiggly-woggly a little bit, one uses a cream to glue it to it, which in itself, I think, is, I don't know, I'm very glad I don't need it. But just the thought of it. However, this stuff seems to have a lot of zinc in it. And while zinc is an important mineral or whatever it is, actually, I don't know what it is, but it's an important thing. So there's even zinc vitamins, zinc tablets out there. But we talked about gum disease. When people have a disease going on, an infection in their mouth, it's right at the gateway. It drips into the blood like unbelievable. So at the same token, if you have zinc right at your gateway of your mouth, at the gums and at the palates and wherever, too much of it goes into the body, and people have gotten nerve problems. Maybe. It's not 1,000% proven, but apparently there are mental and physical damages potentially there. Tell us what it is. Tell us what people can do about it, because that doesn't sound like a little thing. If it happens. See, I don't like Russian roulette. I might be doing foolish things in life, play with business and here and there on the verge of going broke because of what I do. But that seems to be something I can handle. But damaging my nerves, I don't know whether I want to play with it.
Right. Okay. Well, okay. Zinc is a mineral, and just like most vitamins and minerals, a little bit is good. Too much is not good. And it's true that denture adhesives, they serve a good purpose. They can give a person more confidence. If they have a denture that may be a little bit loose or a little prone to move around too much, that's okay. But they need to use it as directed. The problem occurred when people were using excessive amounts of denture paste and creams to hold in a denture that was way too loose, and they were just putting globs of it in 2-3 times a day. And because the manufacturers added a little bit of zinc to make the product more effective in adhesive, the people who were using too much of it ended up getting too much zinc in their system and then showing up with these neurological type problems. All the research is not in yet, but it seems to be what's happening. So people are encouraged to use it as directed, not to use excessive amounts. If their dentures are loose, see the dentist. We can do relines, or if need be, we can make a new denture so that the amount of adhesive that you can use is either none or very minimal, and then you wouldn't have to worry about these problems. Like I said, a little bit of zinc is okay. Sometimes zinc is good for colds and other problems.
Okay. Well, so let me ask you. I mean, you dentists these days, you make what I call a hybrid, or it's a implant-supported denture, where you put 2, maybe 3 implants in it, and the whole denture snaps on it. And when you do that, the chances of that denture ever becoming loose and needing adhesive is literally 0. Am I right there?
Right. The implants can add a lot of stability to a denture. That's true. It's just almost like having teeth holding in a partial plate when the implants hold in a denture.
Right. I've heard, some dentists have said that a implant-supported denture, which is, of course, a tremendous amount of cheaper than all implants, is yet literally close to as good as all implants to a certain degree, as like day and night compared to a normal denture. So in terms of eating an apple or ripping apart a spare rib. Is that true in your opinion, or is that a little bit exaggerated? What's the deal there?
Well, every person has their own individual experience. Some people do quite well with the traditional dentures. Other people find it rather uncomfortable. They're not as able to adjust to it, to hold it in place. And so in that case, they would use adhesives. If adhesive still doesn't do the trick, then the implant-supported denture may be best for that person.
So let me ask you, I got that. So, but of course we just talked about the adhesive. I mean, I personally wouldn't want to use it even a little bit anymore. Again, because in the gums, the gateway to the blood vessel is so strong that any little thing may be too much. Personally I haven't trusted a drug company yet, and the people who make the adhesive are a drug company. And I would want to stay away from it. I don't think we have been born with this deficiency. So wouldn't a denture-supported implant, that would be a good solution, because not only do you not need ever an adhesive, but with no doubt you can bite better, and also you don't have that plastic plate on the top of the palate, so you can taste food better if you don't have a denture but have a implant-supported denture, right?
Yes, that's true. If it doesn't cover your palate, that's true. You can get more sensation of temperature and the food. It's also true that the denture adhesive companies are now coming out with zinc-free formulas. So there is less worry about it than in the past. The companies, the pharmaceuticals, are responding to these new developments as they occur, and they're adjusting their products accordingly.
I'm sure they do. I'm sure they find another poison to put in. But anyway, so what should a person do who maybe has tingling fingers, numb fingers, weak muscles? Maybe he does wear dentures, and it's not that this type of stuff, this nerve problem, comes only from the screen. People can get that anyway. Should they go and visit a physician and get a testing done, or maybe a podiatrist who does a lots of nerve testing also, as far as I know, and at the same time should come to you and realign their denture, whether it's with an implant or just make it better new, so that the cream doesn't have to be used? Because it couldn't be comfortable having to use a cream in the first place. I can't see where this is a comfortable thing. I mean, I just can't see it.
Yes, if there is a problem with the fit of the denture and a lot of this adhesive cream or paste needs to be used, if there is some chronic pain or tingling or sore spots, yes, definitely see a dentist or the physician and have the problem looked at and diagnosed, so you can follow through and take care of it and not just let it go on and cause chronic greater problems.
Right. Even if the tingling, the numbness, the weak muscles, even if it wasn't caused by the denture cream, it's a systemic nerve problem, and it should be checked out anyway, because nerves, once they go over a certain break point, they cannot, it's difficult or impossible to bring them back to normal. But if they get, so to say, fixed and nourished before they reach that point, they usually can be, like most other body parts, still be saved, right?
Right. Earlier recognized, more chance of a full recovery. Yes. Okay.
Well, thanks for shedding some light on this whole thing. It's nice to hear that the cream manufacturers, responding to it as they should, and as I'm sure they would. But at the same time, it looks to me that if you realign your denture often enough, and even go a step further, get an implant, a couple implants in it, which isn't all that expensive, and yet have then forever a great fitting denture where you can chew on it much better than with another one, and never need any cream, which couldn't be comfortable and can taste the food. Looks to me that's like, die and go to heaven or something like that. All right. Bye-bye, Dr. Crayle.
Thank you very much.